See how we're looking here. We'll give it a few more seconds for everyone to finish getting logged in and connected. But we're going to get started pretty quickly here because today we have Dr. Adija Oganyemi, and she is going to be an absolutely fantastic presenter. So I'm really excited, and I want everyone to have as much time with her as possible. So we will go ahead and dive in today. Thank you. Welcome everyone to the second session of our Recruitment Boot Camp focused on mental health staff. So just a quick reminder before we get started here, we'll make the recording of this available to everyone, and you'll also be able to find the slides from today on the discussion boards. If you have any technical issues, go ahead and send a message to Mariah and she'll help you get that sorted out. And then we'll have an evaluation at the end of the session. Just be sure to finish that up before you jump off of Zoom. And as always, we're here on behalf of the Association of Clinicians for the Underserved and ACU's STAR Center, the Solutions Training and Assistance for Recruitment and Retention Program. And all of the STAR Center resources that you can find at our website there are free for all of the health centers. And so please reach out to any of us on the STAR Center team if there's anything we can help you with. But now I will get ready to turn it over to Dr. Oganyemi. She is a practicing therapist at a health center in Detroit, correct? And she is also a professor of sociology at a community college there. And then in her spare time between those other two jobs, she's also a social innovator and works to help close healthcare gaps by advocating for mental health promotion, protection, and treatment. And she does lots of speaking engagements, community outreach, staff education, all kinds of things. So I am really excited for us to have Dr. Oganyemi here. She and Michelle go way back, so I will turn it over to her here. Let me stop sharing my screen and I will let her take it away.
All right, can you see my screen there?
Yep, you are all set.
Thank you so much, Alec. Good afternoon, everyone. Once again, my name is Dr. Adija Oganyemi, and it's a pleasure to be with to be back to take a session or two for this recruitment boot camp for mental health providers. So a quick description of our session today, and we all know, even with the news and everything that's been going on in the world, in the recent 2.5 years or so, that the demand for mental health services is increasing. And with many organizations reporting a rise in the demands for services, there are too few mental health providers to meet this growing demand. So organizations that provide mental health services need to improve their strategy to recruit and retain their mental health providers. And as you participate in the session today, I want you to pay attention to elements that may be missing from your current recruitment and retention efforts, because every single one of us here today, we're work for, we're either department lead for a mental health department in your organization, or you're in HR. So you already have some recruitment and retention guidelines in place, but I want you to specifically pay attention to some elements that may be missing from your current efforts so you can add to that and make it better. Okay, so our session today has been divided into 3 parts. Part 1 will cover what to include in your job announcements and the language. We'll go over some recruitment and retention strategies, and then we'll close today with a case study. If you have any questions for me as we go, please, put it in the chat, and Alec or Michelle or Maria, they'll let me know so I can address them as they come. As Alex said, the session is being recorded, and we all know like the Zoom housekeeping rules, so we want to make sure that we do that. I want to encourage you to participate. This training is meant to be both educational as well as interactive. So if there are any parts or portions of this session that I ask questions and looking for feedback, please be sure to do so when that time comes. So now going into part 1, job announcements and language. And we cannot talk about job announcements and language without first talking about brand, right? before we even go into what your job description or what your job post or what have you should look like on LinkedIn or whatever platform it is that you use to publicize your job announcement. What is a brand? When we think about brand, we might think maybe it has to do with maybe people that sell products. We might not think about it as it relates to, like a human service organization, but as a human service organization, you need to have a brand. A brand can be something as simple as a name of an organization, a term that's associated with the organization, a design, a symbol, or any other feature that identifies, what you're providing, the goods or services you're providing that is different from other people who might provide the same things, right? Branding, on the other hand, is defined as that process of creating a strong positive perception of a company, its products or services in the customer's mind by combing through, elements such as logo, design, mission statement, and a consistent theme throughout all your marketing communication. So they're all in unison. So when people see you, they identify a particular theme or logo or slang to your organization. So just by a yes or no in the chat, how many of us can say in the room that we feel like your individual organization have branding, their branding is in place, it's top tier? How many of us can say that in the room? See, Whitney said no. Would love to hear from others. Olivia. So we do okay. We have a good solid branding. Okay. Yes. Yeah. It is important. Believe it or not, looks can be everything. And as it comes to, attracting the right candidates who want to work for your organization, packaging matters. It goes a long way. It piques people's interest. It's like, oh, what is going on over there? When we think about companies like Starbucks is used a lot as an example when it comes to packaging. It's just coffee. There's nothing special about it. It's just coffee. However, they've been able to create like this lifestyle out of it and this huge following that you can't even go, you can go in the morning between 8 o'clock and 8:15, you might not be able to get your coffee or you might be late for work because they've been able to brand themselves in such a way that people want to be a part of that Starbucks community, right? So experiences and interactions with an organization's facility, their service, their websites, all of those things, they help shape a brand's image every single day. And although this type of shaping will occur naturally, branding techniques can help guide it in a favorable direction, meaning that you have to be able to put the right images and the right things out there to communicate the right messages about your organization. In healthcare, an organization's image can be very influential. In addition to having, the potential to attract more patients and funding, which in turn could be, the difference between layoffs and, cutbacks of a thriving organization. It can help improve your community's health outcomes and offer good jobs to people. So organizations, especially healthcare organizations in this day and age, we have to pay attention to how it is that we are promoting ourselves. How do we look from the outside looking in? If you were not a part of your organization, if you're just looking at websites like, okay, I'm shopping around, and we go on your website, which is your virtual real estate, what is it really telling you about your organization? So you have to make sure that, your branding as it relates to your organization is something that is authentic, because we don't want to say that we do things that we don't do. And then you hire the candidate and then they come on board and they're like, oh, wait, this is totally different from what you guys said on your website or for what, I learned during the interview. So we want to make sure that it is authentic, it is attractive, it is visible. Think about how you brand yourself as an employer. What is the message that you're trying to send to prospective candidate? How are you communicating your mission, your vision, and your values? Are those things tied into your day-to-day work? I remember before I started working in the outpatient space, I worked in the hospital system for quite a while. And I remember one of the things that I know that the hospital did well was how every single day, the work that we did was tied to the mission. When we did our morning meetings, they talked about things that was related to the mission and vision of the organization. Our badges on the back of it, it had the mission and vision and what we can do every single day, to add to that. That's one way that they continue to communicate that. They even had something called the Bravo, which was like it was a currency in the organization. So the Bravo, if you got one Bravo, it represented $1. So you can, if you accumulate so many Bravos for doing something that's connected to the mission, you can go to the cafeteria or the gift shop to buy something with that. Those were ways that that particular organization, made it more increased our awareness about how they're very serious about us doing things that are connected to their mission and vision. And I thought that they did that really well. So speaking of branding, we've talked about all those things that you have to do. Where do you start from? You have to start with your website. What does your website look like? Does your website, does it need updating? Many of us, we just had a website. Many organizations just did website because it was a cool thing to do then, and it was never updated. Some of our websites still have providers that have not worked for the organization in years, or maybe they've left. It needs updating. For those of us in the room, how many of us believe that our website needs updating? Is your website up to date? Does it need updating? Yes or no in the chat? Okay. Okay, somebody said it just redid theirs, fully up to date. Someone said it's fine. Some people said yes, it needs to be updated. Absolutely. The website, again, is your virtual real estate, and it needs to be constantly updated. There has to be somebody in charge of that is sharing new information. Like I said, if you have providers on your website that maybe have transitioned to other roles or have left the organization, there should be a clean sweep of all those things to make sure that they're up to date. So patients are not saying, oh, I thought Dr. So-and-so still worked here. That's why. Just make sure that things are updated. It is important. Do you have patient and staff testimonials, on your website? That is important because you have, we call that like, it's a social proof, I think that's called, where you have people that are attesting to what you're saying that your organization does. Whether it's a patient, I like coming here because or a staff member, I joined this organization because it doesn't have to be any lengthy, testimony, just something simple that speaks to what you say your organization is doing. All of these elements can help present your organization in a positive light. And you definitely, when it comes to branding, you want to start from your website. Also, when we think about building a compelling job posting, we want to make sure that we are writing ads in advance. Make sure that you have like a team, and we'll talk about that, I believe, in the next session. Have a team where you come together, write the ads in advance. You don't want it something that is too lengthy and too wordy, just something that's straight to the point that shows what you're looking for and what you're able to offer and why it's a good place to work. Those are things that potential candidates are looking at now. Believe it or not, COVID has really switched people's mindset on how they want to work. They want to know that the type of job the type of organizations that they work for is in line with their values. They want to know that the organization cares about their well-being as a person. That people are becoming very picky, so to speak, as far as where it is that they want to work and whether or not this organization is a good fit for them. It's no longer the other way around. People are looking, is this a good fit for me, for my family, for my life, for my values and my beliefs? And we want to make sure that we're communicating those things to potential candidates so they can know upfront. Highlight your health center. What makes your health center unique? Every health center is different. Some health centers, they might be positioned in an environment where maybe the number one chronic health issue there is diabetes. Talk about how your health center is helping with solving this social problem and how bringing this new provider on board will help to further the work that you're doing in that area. Talk about how, the depression and anxiety, increase in the community and how your health center, is answering the call to help decrease mental health issues in that community. You want to be able to tie it into a bigger social good so people can say, oh, I want to be a part of that. Okay, so we want to make sure that we highlight the community as well. Why would somebody want to live there, or why would somebody want to work there? Talk about, I work in the Detroit area. There's a lot of cool things about Detroit. It's Motown, it's where the big three are located. There's a lot of nice restaurants. I care about restaurants. There's a lot of nice restaurants in that area. You want to highlight those things, because believe it or not, the things that we're thinking it's not that important could be a big deal to somebody else. Okay, include the benefits and positives about your health center. Why is it a great place to work? Have people that are work for your health center for a long time talk about why they've remained with that, with the organization. Staff testimonials are really important as well. Okay, I want to look at doing paid ads. You can do ads on Indeed. I see Facebook is doing something now as it relates to the workplace. And believe it or not, that's where people are going to look for jobs, because people spend a lot of time on social media anyways. So, have a social media presence. What does your Facebook page look like? What does your Instagram page look like? Is that even updated? Because people are going to those places as well. Blog posts, that could be very tasking, because you have to have somebody that writes the blog posts and things like that. But maybe that's something that HR can be a part of and commit to doing a blog post a month, or a blog post every 2 months. Job descriptions, even if you don't have openings, having those job descriptions on a website so people can say, oh, okay, if something becomes available, I think I'll be interested in doing something like that. Have career pages on your website. Have photos and bios of current staff. It is so important. It adds a nice look to your website, and it also puts a face behind we hear providers, mental health providers, whatever providers. It just puts faces behind those names, so people can, see people that work there in real time. Like I said before, also the testimonials from our current staff and patient is important. And like we talked about, with social media, many people use social media for job search now, not just to look at beautiful pictures and videos. How are you utilizing social media? LinkedIn is a big one. LinkedIn is like Facebook, but for people, for work. Use LinkedIn. A lot of people are finding jobs nowadays on LinkedIn. Use Instagram. And like I said, Facebook is doing something now too, in that space. I started an ad recently where you can schedule an interview on Facebook and do something. It was interesting. But, social media is a big one. It's a big tool that we can use. And for the most part, it's free. Okay. Want to, start with your website. Add your social media links, whether it's LinkedIn, Facebook, Twitter, or YouTube, add those things. If you have community events that you want to, that you do with your organization, have something that, you can record and share, as long as it's HIPAA compliant, of course. I see something in the chat. Somebody said, one thing I've also heard from job seekers is that they want to see the website that includes more than leadership in the staff section of the website. They view this as showing that the organization cares about staff. Absolutely, absolutely. And that's exactly what I'm speaking to as it relates to staff. We want to see the people that are doing the work.
And
I don't know.
That was me. And
Go ahead.
it came from a reading that I did where some job seekers now are viewing websites that only have leadership on them as red flags to not work in that organization.
Interesting. Yeah, we want to make sure that it's including everybody that works there, not just the leaders, because the leaders they don't know what's going on, if we're being honest. They don't know what's going on because they're not the frontline staff. So you want to have people there that can speak to the work, in real time. I mean, everybody has their own, everybody's role is important, but we want to have people there that actually are in the front line. Moving into language. This is a topic that is going to continue to evolve. I might say something today and then tomorrow it might change. And that's okay, because as we're moving up more into an inclusive space, not just in the workspace, but just in the world, we have to learn to use language that includes everybody. right? As much as possible. And the way that I approach language is with humility as well. If there's something that you don't know, don't be afraid to ask. People will respect you more by asking and say, okay, how do I say that? How do I address you? What pronouns do you use and things like that? It really goes a long way because it shows that you care about the human, right? So speaking of language, to attract high quality language, you should consider using languages that is welcoming and inclusive in your job posting. And a well-written job description speaks to diverse applicants while being specific about the required skill set that you're looking for. Leading with sensitive, thoughtful, and inclusive language shows candidates that your workplace is inclusive and that it considers all applicants regardless of their gender, background, disability, or status. So we want to make sure that we're using inclusive language. Some specific examples. You can use words like empathy rather than saying compassion or sympathy. Use positive language, not something that's all like, clinical jargon or anything. Use positive language, recruit strength-based practitioners, emphasize goal setting as well. Answer the questions why. I've seen some job posting I've seen the organization say, why work for this organization? And they would say, this is the reasons why you should work for this organization. Explain who your patient population is. A lot of community health centers are located in rural, urban areas, and they serve primarily low income persons. You want to talk about that and why the work that you do in that space is important. Mention the mission of your organization. Mention that things are tied together. And if you're somebody that's like, okay, I hear you, Dr. O, but this is a lot. It might be beneficial for your company or your organization to invest in hiring a PR company that can come in and help you put all of these things together. It takes money to make money. So spending a little bit of money, working with a firm that can really help with the branding will go a long way as it relates to recruitment and retention of candidates. Avoid language that connotes a burnout environment, such as using, under pressure. I think the last time we talked about, job posting that talked about, oh, this is a fast-paced environment. It could be true that it's a fast-paced environment, but that can communicate the wrong thing to a potential candidate. I think Michelle and I talked about that during the last recruitment boot camp. So using words that are true for the type of work that you do and the type of environment, but not something that would turn a potential candidate away, because nobody wants to work under pressure. That is a lot.
And with that stuff, it's more describing what they would be doing on a regular basis rather than just using those buzzwords, because very quickly people are like, red flag. So yeah, and Adija, we talked about that for sure.
Yes. Show that your health center cares about its workforce and values mental health. Mental health is not going away. And I can't tell you, even as a mental health provider, how excited I am that the way I see mental health being discussed now has never been the case in the last 15 years that I've been doing this work. And, people are not afraid to say now that I'm taking a mental health day. I just need a day off. They don't have to lie and say they're sick and start coughing on the phone or whatever people do to get a day off. People are very straightforward now, and they want to know if your organization values their employees' mental health. Also include salary ranges for people so they know, because you might not have, people might be expecting a particular amount by the time you go through all of the process of interviewing and all of those things, and then you find out that, they don't want to take the job because the salary is not what they were expecting. Just be upfront. So at least when you're getting people, it's people that already seen the salary ranges and they're, interested in pursuing the position further. Making your job posting personal as well. There was a LinkedIn study that I found in 2019. They talked about how words impact people differently, and how as recruiters, we must be careful about how we use words in our job postings. And the language, different genders use to represent their experiences vary. Open language is more likely to attract gender diverse candidates. People react, positively to language such as powerful, strong-willed, confident. We're looking for a confident client, an expert in this field. There's ways to do, all of those wordings. when applying for roles, women are more likely to prioritize terms that relate to their character, such as likable, supportive, this is a supportive work environment, things like that. More definitive terms, they're off-putting. For example, 44% of women will be discouraged from even applying for a role if the word aggressive was included in a job description. If anybody sees the word aggressive in the job description, just run, because that is not the place to be. And we don't want to include that in any of our job, postings. We want to be careful about the type of language that we're using. So again, we're attracting the right candidate for your organization. Okay. Developing inclusive job postings that appeal to underrepresented clients is also important. Talent, rather, is also important as well. For example, 1 in 4 women will be discouraged from working somewhere that is described as demanding. Consider using words like supportive, diligent, and confident to describe the type of candidate that you're looking for. Also, words like dynamic should be used instead of pressured or demanding environment to avoid suggesting a negative work environment. Because we have to be mindful that even specific words, they signal certain things, they mean different things to different people. And if you're saying there's a demanding work environment, people are going to think, oh my God, they're going to work me to death. I don't want to do that. So using words that, that are welcoming is important. Okay, there was this Twitter post that I saw, and it was about Twitter's mission in 2020. Twitter engineering, they tweeted this words matter hashtag post, and they announced that their internal inclusive language list was going to change. And they said inclusive language plays a critical role in fostering an environment where everyone belongs. And they said at Twitter, the language we have been using in our code does not reflect our values as a company or represent the people we serve, and we want to change that. Are there languages and words that you're using in your organization that are outdated and needs updating? HR should be coming together to do some, to change it and update it. I remember when I worked in the hospital system, just like every organization has their own type of like Bible, we had our own kind of like dictionary of words that was unique to the hospital system, right? There's certain things sometimes I still write that way, but I learned it from the hospital system. It only makes sense in the hospital system. It doesn't make sense anywhere else. So there are things like that with organizations. Maybe you have that and it needs to be updated to more, to more acceptable form of language and welcoming, inclusive, that's what I'm looking for, inclusive language, so people know things to say and what to do when they're writing emails. Maybe that's something that HR needs to invest in, to do as well, because it is important and it goes a long way. Okay, now we'll go into communicating your mission, vision, and values. But before we do that, do we have anything in the chat or any comments so far? No.
Nothing yet.
Okay. All right. So communicating your mission, vision, and values. Every organization has a mission statement and a vision statement and values. And sometimes it's just there. And it doesn't really, tie into everyday work for people. For everyone present today, we should be looking for ways to tie everything together, to bring everything together. A mission statement is a short formal summary of why an organization exists, its aims, and its values. What is your mission statement? If I was to ask anybody in the room, you can just type yes or no. Do you know your mission statement? Oh, I see a lot of yeses. That is awesome. That is awesome. If you don't know it, print it out, put it in your office. So it's a reminder to you, even, as a professional, that you know that the work that you're doing is tied to this bigger purpose. And it should be included in our job postings and descriptions as well. It should not be excluded from it. A vision statement that describes the goals of a company. It states, what the company is trying to build and serves as a touchstone for future action. So it could be that, in 2024, we want to have served, 50,000 clients. That's just an example. Like that's one of our vision. We want to serve 50,000 clients in the community. And if you're looking for candidates, it's good to like put that in there so people know, oh, I want to be a part of that. People want to know that the work that they're doing, is of social good and it ties to a larger purpose. So for someone like me, I look for things like that with organizations as well. What is the organization vision? What are they trying to accomplish, in the next 3 to 4 or 5 years, and how can I be a part of that? So tie it to that. You might not even have an official quote unquote vision statement, but maybe you as a leader, I don't know people's titles in the room, but maybe you as a behavioral health director or HR, you are aware of a vision for the company. Sharing that when you meet with potential candidates and say, oh, we would like to do this within the next 3 to 4 years. And how can you be a part of that? And that could even be an interview question. So people can, talk about how they will add value to that particular vision that your organization is seeking. Okay. Now we're moving into recruitment strategies, recruitment and retention strategies. So this is specific things that you can do. What does your organization have to offer? So we're looking at 3 things. The NHSC loan repayment program, which is a big one. I personally have been a beneficiary of this particular program because I work in my primary job. I work in a community health center. So I've been able to pay off my student loans under this program. And I've stayed. I've been in the outpatient space now for 7 years or so, about 7 years. And part of the reason that, I've stayed is because I was able to get my student loans. And I'm like, okay, I like working here, so I'm just going to stay. 7 years later, that's well over the 2 years that's required. I'm still working in this space. So it's a good way to like get people to join the pathway and pipeline programs and telehealth investments. So I've included, I believe everyone would have access to the PowerPoint. I think Alex said that. So there's the federal loan program that gives licensed primary care clinicians. And we're talking about primary care clinicians. We're not just talking about doctors. We're talking about mental health professionals as well. In any eligible disciplines can receive loan repayment assistance through the NHSC loan repayment program. Add this to your job announcements. If this is something, if your community health centers FQAC qualified, make sure that you're adding that to it. Like, if you join, these are the benefits. In addition to the salary, the paid time off that people would have access to should they choose to join your organization. These are some other benefits that they can be a part of and how your HR would help with that. Make sure that you're adding that, because even though that's not something that the organization directly offers, but that's a benefit that they can get through working for the organization. Also, there are the state loan programs. The state loan programs, they help HRSA provides them grant funding to states as well in different territories to operate their own loan repayment program. I also left a website for that as well. And with that particular website, when you click on the links, it will give you the HRSA page itself that you can go to get information that they update it periodically. I think that the new cycle might be opening up soon, because it's usually towards the end of the year or beginning in January where they'll open up the application period. How many of us are familiar with this already? The federal loan repayment program and the state loan programs. I see Cynthia has a hand raised. Okay. Ingrid said no, shaking your head. Okay. So please make sure that you're adding that to your job posting, because that's a good look. And a lot of people don't know that. I've had a few people that have joined just because I told them about it. They were not aware of it. It's real money. There's no gimmicks with this one. That's right, Sean. It's real money. And sometimes people didn't believe me. I'm like, no, seriously, I got my loans paid off through this program, because sometimes the public service one is kind of been weird for different states, but this one is a real one. Cynthia, congratulations. Awesome. All right, so the pathway and pipeline programs are also important when we're looking at retention and recruitment. And, they're otherwise known as internship or training programs that gives, prospective mental health professionals the opportunity for career exploration and development, and also to learn new skills. It allows people to be able to develop professional competence under supervision and build a pipeline to become future full-time employees. One thing that I didn't include in the slide, because I don't know how true it may be for different states, is sometimes you're able to hire a limited licensed clinician that will work underneath a fully licensed person, and you can still bill the insurance with that. So if you're working in an organization where, in your area, the provider availability is just really low, you might want to look into hiring somebody that's limited license that of course can work underneath someone that's fully licensed in the same discipline, whether it's psychology to psychology or social work to social work, that can sign off on those things, because that's something that people do. So you just have to check with your state regulations and laws, before you move forward with that. But in Michigan, that's something that, organizations have done. Okay, is anybody currently doing that right now? Cynthia, do you want to say a little bit more about that?
Yeah, I can. So I have quite a few limited license behavioral health counselors, so limited license social workers. And the only insurance programs in Michigan that they can't bill is Blue Care Network and Medicare.
Are you in Michigan as well?
I am.
Awesome.
Yep.
Okay.
So it's
So, yeah.
easy. We do supervision. We kind of do group supervision and then individual supervision, and I supervise all of them and I sign off on their notes. So it's a little bit more work for me, but it also takes some of the workload off of me that they can see, like Blue Cross Blue Shield, and they can see the Medicaid plans.
Yeah, it's definitely more work on the supervisor's end, but it just increases the number of providers that you can have. So that's another strategy that you can use. Thank you so much, Cynthia, for that. Let me see if anything. Somebody said yes. Somebody said limited payers. What do you mean by that, Sean?
Just what Cynthia just said regarding you can't bill Blue Cross Blue Shield or Medicare. So
Okay, yeah. So another strategy that can be utilized for retention and recruitment is telehealth investment. Telehealth not only increases access to mental health services, it can also expand applicant pool and provide provider-to-provider support for delivering mental health services. So when we think about telehealth, before the pandemic, telehealth services was available, but it's limited in different spaces, right? But now insurance companies, they've kind of relaxed a lot of the rules, that were in existence before the pandemic, to where you can hire people, from outside of like your immediate area. So telehealth services, that could be something that your organization decides, that could be a route that you could go as it relates to having a provider that works from home or work remotely, service some of your clients. So that's something that could be done as well as it relates to retention and recruitment, because again, people are looking for more of a work-life integration. And if, some people might want to work part-time, but, because of their life, their lifestyle or what have you, they're not able to like come into the office. But if you have an opening for telehealth services, that can help provide services to your clients. Anyone in the room currently using telehealth as it relates for remote work? Anyone? Let's see, no, yes. So it could be something to think about. If you're struggling with finding providers, that could be something that you offer. Maybe you might want to have a balance, maybe 2 telehealth providers, 2 in office, so that way you have somebody on ground or you have certain people on ground. But that might be something that you need to talk about with your leadership team to see. But it was very hard on our PCPC to collaborate with behavioral health. Absolutely. And depending on the type of system that you have in place, that could be challenging I can say like for me, because I still do some telehealth services, it's not an issue at all because we all use the same system and we have access and messaging and all of that. So it can definitely be done. I know some hospitals that do telehealth as well in their ER, actually. Okay, all right. Thank you. Okay, let me see. That's it. So moving into diversity, equity, and inclusion, we can talk about DEI all day, but just some things to consider as it relates to retention and recruitment efforts. What does your organization's DEI statement look like? Is it something that needs to be updated as well? You know, add it to your job announcement. What does your organization stand on DEI issues? Make sure that that's being communicated to potential candidate. Highlight inclusive job, inclusive benefits, mentorship programs for BIPOC communities and other underrepresented staff, needs accommodation, inclusive leave absences. There's this statement from Center City Concern Equity Commitment, where they talked about, this is like their BIPOC statement, people of color and members of the LGBTQIA plus community experience homelessness at a far higher rate, and this is unacceptable. CCC is committed to significantly reducing this disparities through improved culturally responsive delivery. This is a very succinct statement that speaks to this particular organization's commitment to underrepresented communities. Do you have that as an organization? If you don't, you should be collaborating with your HR department to come up with your own DEI statement. So that could be included in your job description as well. Okay. Also, other organizations to look at as it relates to expanding your applicant pool is the National Hispanic Medical Association, the National Black Nurses Association, the National Association of Hispanic Nurses, National Medical Association, the Out Professional Network. These are all useful resources and organizations that you can collaborate with whenever you have job postings. Make sure you have a contact person with each of these organizations. So when you have job postings, you can send it to them and they can send it to their network. Another organization is the National Association of Social Workers. I'm biased because I'm in Michigan, so I'll speak to Michigan. Michigan has a pretty large membership rate as it relates to the NASW, and they send a lot of emails. They can help you, we're sending emails to their members about job openings, and you can recruit candidates that way. So those are things that, other strategies I think that we need to utilize when we're thinking about recruitment and retention. So now we'll move into our case study, and we have a little bit of time to do that. Because not only do I want to provide you with some, educational aspect of how we can improve recruiting mental health providers, I also wanted to give us like a visual example of an organization that I think is doing it well as it relates to branding. And again, remember what I said at the beginning of our session today, take what you need. You might already be doing some of those things, but how can you make it better? That's really essentially, what I want us to take away from today. Sean, I think you need to be a member to receive those emails, but I also think that you can sign up.
Yeah, Adija, for the emails, you do have to be a member, but I think for the posting, you may not, but I'm actually going to ask the board, since I serve on the DC chapter, and I was going to do this for someone else, how they can go about posting, and I can bring that information to everyone.
And I think in Michigan, they have there's a particular part of their webpage where they just put job updates there as it relates to Michigan. So I don't think that's specific to only members when it comes to the job posting. But, we can double check that. So moving into the case study, this is when I got into the outpatient community health space, the organization that I was with at the time, yeah, that's true. I see every state has their own chapter that does their own posting. That's true. They have their own ways of doing things. The organization, when I got into the community health center industry, like I said, 7 years ago, the organization that I was with at the time, they sent us to this training for behavioral health consultant training in Tennessee. And this is one organization that I think is doing the branding thing quite well. And that is the Cherokee Health System. I don't know if anybody has ever heard of this particular organization. I'm going to stop share so I can pull up their website, because this is something that I just want us to take a look at, how they capture all of the things that I've talked about today as it relates to branding, the training, the pipeline. Here we go. So Cherokee Health System is a community health center, and I believe it's also a CMH as well, in Knoxville, Tennessee. They have a beautiful facility there that we went to do the training. And see, there's not really anything too fancy about their website. However, it captures the things that I've talked about today, talking about the about us, going into the who we serve, the language that they're using. It's not a whole lot, but it's very simple. You know, Cherokee Health System is committed to ensuring every Tennessean has access to effective, high quality care. We don't think anything should stop someone from getting the care that they need. And that's why we make our services available to anyone who needs them. Look at what they talked about in 2021. Here's what we did. So a potential candidate can look at that and say, oh, they did quite a lot. They served 70,000 patients in 2021. That was just last year. I want to be a part of that change. I want to be a part of, you know, an organization that is doing this much good in the community. Now, something simple as that. Then you have the leadership team. You know, they have that there. Going into services, they have the services that they offer, and all those things. They have patient info, if you need to schedule an appointment, medication refills, their careers, they have the open positions. See, they even use a picture of happy people. It might not be their employees, but happy people. That's a beautiful picture of one of their facilities. You know, a lot of us, we have our beautiful buildings and things like that, that we need to take pictures of so people can see what it is that we're offering in the community. I'm trying to find a behavioral health specific job posting, just as an example. I believe they call their mental health providers, like their therapists, I think they call them behavioral health consultants. You know, there's a lot of things that we can take away from this. Let me go back to their training page. I actually like that one as well. If you work for an organization that doesn't have like training or internship in place, you're really missing out. Because this is not only, it's a mutually beneficial program, if we want to look at it that way. When you have interns, especially like master level interns or, you know, psychology interns, they can really be of great use to your organization, and a great asset rather to your organization. They have the Integrative Care Training Academy, which is what I was a part of years ago. They have the APA psychology internship. So if you have, you know, psychology students or doctoral students that need to do their training, they can come to their organization to train. They have the practicum experience for, I think, undergraduate students. You know, if there's any behavioral health director in the room, I think that this is something that you should look into, you know, developing like your own internship program so you can recruit people that way, especially if they're students that are graduate level, because you know that they won't have that much time left in school, you know, before they can start working, and they'll have their limited license. You know, like Michigan, yeah, you have your limited license right away and work for 2 years or so to get all of your hours and all those things. As for social workers, I'm not sure how a psychology process goes. So this is just an example of an organization that I think they're in the right direction as it relates to branding. And again, you know, we can learn a thing or two from other people. Nobody's going to have everything, 100%, but at least if I can take a little here, a little there to make whatever it is that you're doing better, I think it can really go a long way. Okay, sharing my screen again. So any questions about Cherokee Health System? Is there anything that you saw on their website that you think, I might want to look into putting that in our own system or way of doing things? Or anything that I've talked about so far? Now we can actually go into that. Before you go, so what are elements from today's session that are missing from your current recruitment efforts? And I'm going to call people all around the room. Let's start with Olivia.
I knew that was gonna happen. Goodness, that is a great question. I mean, I feel like we've got our brand down. So I focus solely on recruitment of all providers. A lot of what you were saying, I feel like we are doing, I guess, as far as building the, I guess the postings and making them kind of short and sweet, something that someone looks at and sees something that's appealing, I think is something that we can tailor to be a little bit better. So that's something that I'd like to go back with my team to kind of redesign those postings.
Thank you. Thank you for sharing that. And I'm glad to hear that you already do some of those things, because that's a good thing. How about you, Ingrid? What are your takeaways from today?
Hi. I believe that we do a good job in general, but I do think that Erie has amazing benefits and programs that we need to make sure that are more out there. When I speak to a lot of my candidates, I realize that they are not aware of a lot of things that we provide besides the basic, general insurance, health insurance, dental, and things like that. So that's something that I do believe we need to make sure that we highlight more in our sites, in our job postings, things like that.
Okay. Thank you.
Thank
Cynthia?
you.
I really liked on the website adding the internship program.
Yeah.
I have 2 interns right now, and it's more of like, was word of mouth, like knowing them through our own avenues, and it's been really beneficial to help get them trained for behavioral health, train them in our EHR, have them get comfortable, and actually provide them with like DBT training and EMDR training as well, and then transition them once they are done with their license. But it would be probably a little bit more beneficial to put that on the website.
Yeah, you're already doing it. So let people
Yeah.
know about it. Yeah. Thank you so much. Thank you. All right, Sean, how about you?
Yeah, thanks. I guess I think everything else is good. Like some other people mentioned, our website, it's very HR centric, where it's basically a job duties type thing. I think, shorter, sweet. And then also we utilize AHEC a lot, which is health education. By utilizing those internships or shadowing experiences for students and everything. But the thing is, we're just limited on the amount of providers that we can supply that with. So we have a couple of hurdles, but that was the main thing that I was taking notes on here, is see if it's possible to change the postings a little bit, and also a pay range. You mentioned that, they always get a little knee-jerk reaction, but I've been in a situation where you've gone through this whole big process, interviews, and finally you get an offer letter, and they're like, oh, okay, well, I was hoping for a pay increase from where I'm at, and this is the same. So it's a tough challenge there, but just a couple tools I took away. So thank you very much.
Thank you. And I think just to add to that, Sean, is putting more about the loan repayment. If your organization is FQHC approved and whatnot, added that to it, because if it's the same pay but you don't have loan repayment, it's really an increase.
Yeah, and a lot of places already, they're so hell bent on this the 10-year public service loan, and I tried talking them down from that. Well, I'm just going to, continue to pay. I go, why? I mean, with the National Health Service Corps, once you get accepted and apply, and we have 100% placement because of our HISPA score. So, I mean, the money they're throwing out there for these student loan repayment is huge, but I don't know if somebody got to them in their education regarding this public service loan, but not many. I mean, in the past, it's getting better, but it's still poor, not a great program.
Yeah, it's been a challenge for some people getting that particular benefit with the state, but that's been a challenge. Tracy said, I think we need to add information to our recruitment ad that says loan forgiveness, salary ranges, and benefits. Okay. All right.
Can I just make a quick comment to what Sean said, and I think Tracy as well? So, and you mentioned this with salary ranges. We weren't aware of this. We had done our workforce summit, and Indeed adds salary ranges for you if you don't add them. So some health centers have, or they do like estimates. Some health centers have had people that they've interviewed, gone through the whole process using the estimated salary range, which is actually higher than what the health center was able to offer. And because the salary range was never put in there, at the very end, it was that very similar to what you said, Sean, but the person was already coming with an idea of like, oh, this was on Indeed. I saw the salary range. That's what I thought you were going to pay me. And then losing potentially some, but also just the money you invest in that whole interview process.
Yeah, that's time. Yeah.
But exactly.
Yeah. Okay, so my said LCSW externship opportunity and other training on our website, DEI statement and short tailored job announcement. Absolutely. Absolutely. So for next time that we're together again, we will be talking about the interview process, compensation and benefits, the career ladder and development for mental health professionals in your organization, and how you can package that. Again, packaging is everything. It can be, it's important, like I was saying with what Sean said, with salary ranges, you might not be able to offer a candidate a higher income, but if you properly package, what you have to offer, and whether or not there's something called like the soft pay, whether it's flexible time and things like that. If you can add that to it, it may make your job posting more attractive to a potential candidate. Thank you all so much for today, for your participation and your input, and just being here today. I appreciate you, and I'm looking forward to session 3, and I hope that you have a great afternoon.
Thanks, you too.
Thank you.
Thank you so much, Dr. Oganyemi. Let me real quick, I'm going to post, and I will post on the discussion board as well. We have a pay equity checklist that might also be useful for people when we're talking about salary ranges.
Should I stop
and
sharing?
posting that.
Or
Oh,
should I
sorry,
just-
yeah. Yeah.
Okay. There you
Oh. Thank you. And so I will post our pay equity checklist as well on the discussion board, but the link to it is in the chat right now. And that can be helpful too in kind of making the case for like, we should have transparent salaries, and that makes it easier to put them on job listings and everything. So I just wanted to put that out there for people. And then I will put the assignment for session 2 up on the discussion board. And that is a little Word document with some tables in it that you can work through, and it's really helpful for tracking. So as you're posting all of these different job descriptions and everything, this provides some tools for tracking how well those things are working, and then also shaping the messaging in your job posting. So it should really relate well to what Dr. Oganyemi talked about today, and hopefully that'll be a helpful tool for you. And then again, if you have any issues accessing the discussion board, please send Mariah or me or Michelle as well a email, and we'll make sure you get on the discussion boards there. And you can always use them to post if you have questions, want to talk to your colleagues from the cohort for the Recruitment Boot Camp and everything. You're welcome to use that discussion board as much as you'd like. And then our next session will be October 5th and same time. Here are a couple of relevant resources there. And we have a compensation assessment tool as well, if people are interested in that. And then Michelle wanted to make sure that I let you all know, she spoke with a colleague at the University of Central Florida, which has a pretty big social worker program, and then also has a social worker training program that's virtual. Let me know if I get any of this wrong, Michelle, but they have one. So they have students all over the country that need placements. And so if you have job opportunities or opportunities for students that are in the process of completing their training and need to get licensure, and so we're looking for those clinical rotations. They said that they are happy to post things to their job board, and so you can send them along to Michelle, and she and I are also available to look at job postings. If you want to send us an example of one that you have, we're happy to go through it and kind of talk about some of these things about how do you turn it into something that's really selling the job, as opposed to the more traditional just list of job activities and everything. We're happy to help with crafting job postings if that's something you're interested in.
Yeah, and Alex, you got it right. I've been trying to use my network of friends to like help. So I do know some people who teach at the social work school at UCF, and I had asked, and they are very happy to take job postings from anywhere in the country to post to their alumni and their students. So if you're interested, you just send it to me and I can send it over to her.
All right. Excellent. And then I think an evaluation should pop up here. There it goes. If you don't mind, please just fill that out real quick. That's really important on our end. And also, if you have any feedback that doesn't capture, please let us know. But otherwise, we, as always, have plenty of resources on our website. We have our podcast. That's really fun. We're working on the next season, should be out fairly soon. And then you can contact us here if we can help you with anything. But otherwise, thank you so much for being here today. And we will see you next week for more excellent insights from Dr. Oganyemi. Thank you, everyone.
Thank you, everybody.
Thank you.